It was ICU nurse Hinda Hassan's first week off since this pandemic started. She booked an appointment with a chiropractor and massage therapist, but shortly after arrival, she was turned away.
It was a little disappointing, and you could see there was a huge informational gap.
At the clinic, Hassan filled out a COVID screening checklist, identifying she has contact with COVID-19 patients, wears PPE on the job, and has no symptoms. But the clinic told her they can't treat her unless she does a COVID test.
I thought that was crazy because what reassures you? Because if I go have the test today, tomorrow I go back to work, then what?
According to Ontario's Ministry of Health guidelines for healthcare providers, Hassan should have been able to receive treatment because she wears PPE during exposure and had no symptoms.
If you needed my service, I can't say, hey, you're high risk, I'm sorry, I can't take care of you. But then here you are, you're denying me those rights.
Clorox wipes.
You're
Tons of those.
Long-haul truck driver Bob Haynes has run into issues too.
I can't even go see my doctor. My doctor won't even see me.
Haynes regularly travels to the U.S. and says he can't get a doctor's appointment, and his wife's dentist canceled a recent appointment unless she isolates for 14 days.
I would like to see them treat us a little more fairly.
The Canadian Trucking Alliance says it's looking into how widespread the issue is.
Asking truck drivers to quarantine for 14 days before they get medical attention is, quite frankly, unacceptable.
The Royal College of Dental Surgeons says unless the person is in need of urgent care, some patients can be asked to do a test or isolate. As for Hassan, the health clinic apologized and updated their protocol for health workers. She plans to rebook. Tashana Reed, CBC News, Toronto.